Hello, welcome to the Pharmacology of Autocoids MCQs Part 1. The first question says that PGE1 cyclodextrin is available for the treatment of severe peripheral arterial occlusive disorder. So in this case, the cyclodextrin complexation helps to do what? Reduce rapid inactivation of the drug, increase water solubility of drug, both A or B, and the last option says none. So let's look at the solution. So the solution here is option B, that is cyclodextrin complexation increases the water solubility of drug. So let's know more about cyclodextrins. They are a family of cyclic oligosaccharides with a hydrophilic outer surface and a lipophilic central cavity. I hope you all know that the head and tail. The head is always hydrophilic and the tail portion is lipophilic, which is to the interior side of the structure. So cyclodextrin molecules are relatively large with a number of hydrogen donors and acceptors. And in the pharmaceutical industry, cyclodextrins have mainly been used as complexing agents, which increases the aqueous solubility of the poorly soluble drugs, and thereby they will increase the bioavailability and the stability of drugs. Hence, the correct option is B, that is, they will increase the water solubility of drug. Moving ahead, we have LCT4 is generated from LTA4 by the action of which of the following enzyme? So the options are GSH transferase, hydrolase, peroxidase and gamma glutamyl transferase. So this is the pathway which follows from arachidonic acid and it leads to the formation of leukotrienes, prostacyclins, thromboxanes. Now the question that was asked is leukotriene 4 is generated from LTA4 by the action of which enzyme? So we have leukotriene C4 and leukotriene A4 conversion, and it proceeds with the formation of glutathione that is inserted in the leukotriene A4 structure. And the enzyme that is responsible for the conversion of this reaction is glutathione S transferase, that is GSH transferase. Hence the correct option is A. Next question. The following is a selective 5-HT1D receptor agonist. Please highlight agonist. The options include buspirone, ondansetron, sumatriptan and granisetron. Let's look at the solution. So we know that the 5-HT1D receptor, it regulates dopaminergic tone in the substantia nigra, which is in the basal ganglia. The anti-migraine drug, that is option C, is sumatriptan, which is a selective 5-HT1D and 1B agonist. And the other functions subserved by 5-HT1D receptors are the inhibition of 5-hydroxytryptamine release, noradrenaline release in the cranial blood vessels. Hence, the correct option here is sumatriptan. That is option C. Next question. Tick the pyrazolone derivative from the following. So for this, you all need to know the structures which are involved in the NSAID classification. We need the pyrazolone derivative. The options include methyl salicylate, analgin, paracetamol, and ketorolac. Let's look at the solution. Okay, so we have analgin, that is option B, which has this pyrazolone derivative, and it is used for treating the pains of different origins and variable intensity. We have analgin injection, which is given during toothache, headache, neuralgia, and in all these conditions. So we have these pyrazolone ring over here, which is present in analgin. We all know the structure of methyl salicylate. It has salicylic acid, and here we have the methyl group. Then we have paracetamol, the simplest structure of all. And then we have ketorolac, which has somewhat this bicyclic structure, and it does not have pyrazolone ring. So the correct option is option B, that is analgin, whose synonym is metamizole. Next question. Which of the following agents could significantly impair the ability to drive an automobile? The options include ergotamine, fexofenadine, diphenhydramine, or ranitidine. So the first generation H1 antihistamines, for example, diphenhydramine, dimenhydrinate, are highly sedative drugs, but the phenyramine, cyproheptadine, and meclizine, all these three examples, that is PCM, they are moderately sedative. They may cause dose dependent sedation. Hence, a patient should be advised to avoid driving a motor vehicle. So, these drugs, that is option C, diphenhydramine, which are the first generation H1 antihistamines, they should be avoided to drive a motor vehicle when the patient is administering them because they cause sedative effect. So, the correct option is C, diphenhydramine. Next question. Prostaglandins has effects on a variety of tissues. The different prostaglandins may have different effects. Now, they need to know which of the following statement is not correct. We need to find the incorrect statement from these four options. So, let's look at the options that we have. Option A says that the human arteriolar smooth muscle is relaxed by PGE2 and PGI2, whereas thromboxane A2 and PGF2 alpha causes vasoconstriction. So, this statement is true. Next, PGE1 and PGI2 inhibits platelet aggregation, whereas thromboxanes facilitate aggregation. So this is also a true statement because thromboxanes do facilitate aggregation. Then we have PGE2, it is a bronchodilator, whereas PGF2 alpha is a bronchoconstrictor. Even this statement is true. However, PGE2 has marked oxytocic action, whereas PGF2 alpha has tocolytic action. This is a false statement, hence it is incorrect. So let's look further. This chart will help you to know the functions of different prostaglandins, thromboxanes. So the correct option here is C, that is the incorrect statement, that is PGE2 has marked oxytocic action, but PGF2 alpha, it has tocolytic action. However, you can see here PGF2 alpha has uterine contraction, that is oxytocic action, but prostaglandin E2, what will it do? It will cause bronchodilation, but PGF2 alpha will cause bronchoconstriction. So please remember this chart for the different functions and effects of thromboxanes and prostaglandins. Next question. Which of the following 5-HT4 receptor agonist is used as a prokinetic drug? The options include mozapride, metoclopramide, domperidone and bethanechol. Let's look at the solution. So the drug that is used as a prokinetic agent is mozapride. Hence the correct option is A. The major active metabolite of mozapride is known as M1, which acts as a 5-HT3 antagonist. This accelerates the gastric emptying throughout the whole of gastrointestinal tract, and it is used for the treatment of gastritis, GERD, that is gastroesophageal reflux disease, dyspepsia and irritable bowel syndrome. And mozapride is recommended to be taken on an empty stomach, that is at least 1 hour before food or 2 hours after food. So the gastroprokinetic agent is mozapride. Moving ahead. Next question. Determine the correctness or otherwise of the following assertion and reason. So the assertion says that febuxostat is a newer drug indicated for chronic gut. The reason they say is it decreases the production of uric acid by inhibiting xanthine oxidase enzyme. The options are whether both A and R are true and reason is the correct reason for assertion. Next option, both A and R are true, but reason is not the correct reason for assertion. Assertion is true but reason is false, and the D option says that both are false. So let's look at the solution further. Now, we have febuxostat, which is a newer drug and it mimics to the activity of allopurinol. Allopurinol is a potent xanthine oxidase inhibitor which is used in the prevention of gout. So because of allopurinol, xanthine oxidase नहीं बनेगा, उसके बाद उसका uric acid जो conversion है वो नहीं होगा. So these inhibit xanthine oxidase and are useful in chronic gout and secondary hyperuricemia. So febuxostat, what does it do? जो conversion है from hypoxanthine to xanthine and xanthine to uric acid. Xanthine oxidase is responsible for these conversions. Febuxostat इसको antagonize करेगा. Hence both A assertion and R, that is reason, both are true, as well as reason is correct for the given assertion. Hence the correct option is A, that is both A and R are true and R is the correct reason for A. Moving ahead. Allopurinol prevents the conversion of. We have 4 options and we need to choose the correct combination of statements. So let's look at the 4 statements given. We have hypoxanthine to xanthine. Q says that xanthine to hypoxanthine. R says hypoxanthine to inosine monophosphate. And S says xanthine to uric acid. So we need to choose the correct combination of statements. Now option A says PR is true while QSR false. Option B says PQ is true while RS are false. Option C says PS is true while QR are false. And D says all are correct. Now we should know that allopurinol, it is a purine analog, a structural isomer of hypoxanthine, and it is a naturally occurring purine in the body, and it is an inhibitor of the enzyme xanthine oxidase. Okay, so first we have to look here. Adenosine gets converted to hypoxanthine. Hypoxanthine, further with the help of xanthine oxidase, gets converted to xanthine and uric acid. And these enzymes, that is xanthine oxidase, are inhibited with the help of allopurinol. So xanthine oxidase is responsible for the successive oxidation of hypoxanthine and xanthine, resulting in the production of uric acid, the product of human purine metabolism. In addition to blocking uric acid production, inhibition of xanthine oxidase causes an increase in the hypoxanthine and xanthine. Okay, अगर हमने xanthine oxidase को रोका, so hypoxanthine और xanthine का concentration in the body will increase. Hence the correct option is C, that is PS is true while QR is false. So P statement said that hypoxanthine to xanthine, which is correct, and S statement said that xanthine to uric acid. However, Q statement was xanthine to hypoxanthine. The reverse is not true. Also, hypoxanthine to inosine monophosphate. Even that is an incorrect statement. Hence, the correct option here is option C. Next question. Prophylaxis of migraine are following and choose the correct combination. So, which of the following combination of drugs are used for the prophylaxis of migraine? Is it propranolol, amitriptyline? Option B is leukotrienes and flunarizine. Next is methotrexate and phenelzine. Last option says flunarizine and phentolamine. So the correct option here is option A, that is propranolol and amitriptyline. For severe migraine, the preferred drugs are ergot alkaloid, sumatriptan, rizatriptan plus an antiemetic. However, for the prophylaxis of migraine, we need propranolol or some other beta blocker, amitriptyline, other tricyclic valproate, topiramate, flunarizine, verapamil, and diltiazem. So these are the classification for severe migraine and prophylaxis. Please remember them. Next question. The long-term use of aspirin in children is associated with which of the following adverse effects? So is it metabolic acidosis, Rees syndrome, renal tubular acidosis, or fixed drug eruption? Let's look at the solution. So aspirin is widely famous for the adverse effect of Rees syndrome in the children, and Rees syndrome is characterized by rapidly progressive encephalopathy, that is in our livers. The symptoms include vomiting, personality changes, confusion, seizures, and loss of consciousness. The correct option here is B, that is Rees syndrome. And due to the risk of Rees syndrome, the pediatric formulations of aspirin are prohibited in India and UK. So remember, aspirin is responsible for Reese syndrome in children. Next question, N-acetylcysteine is useful for treatment toxicity due to which of the following drugs? Is it acetaminophen, cyclophosphamide, aspirin, or methyl dopa? So we have N-acetylcysteine. We should know that N-acetylcysteine is the famous antidote for the toxicity which is caused by acetaminophen. Now, acetaminophen has a very interesting metabolic pathway. So, in its minor pathway, it forms the metabolites, that is aniline and other aniline derivatives, which causes methemoglobinemia, that is hemolytic anemia. These are fairly non-toxic metabolites in order for its consumption. However, when this N group is hydroxylated, if you see here, because of acetaminophen and phenacetin, in this pathway, we form a structure that is a hepatotoxic metabolite. It is called as NAPQI, that is N-acetyl imidoquinone derivative. This structure is highly reactive and it forms conjugated bonds, or it reacts with the hepatic proteins and the proteins that are present in the kidney cells, and thereby it causes hepatotoxicity and nephrotoxicity. So, in order to prevent this, in order for NAPQI to bind to the sulfur containing proteins and amino acids, we give the patient N-acetylcysteine as an antidote. What will they do? Instead of reacting with the proteins, these NAPQI derivatives will react with the N-acetylcysteine and form a water soluble intermediate. This is easily excreted from the kidneys. Hence, the question that was asked, that is N-acetylcysteine is useful for the treatment toxicity due to, the correct option is acetaminophen, that is option A. Next question regarding histamine. So we have four statements here regarding histamine. That is, histamine is beta aminoethyl 5 hydroxyindole. So remember, this is a false statement. I will mark this for you. Then we have histamine acts by a G protein coupled receptor, which is a true statement. Then we have histamine is orally as well as parenterally active. No, false statement. Then we have increase in the intracellular camp inhibits histamine release. This is the true statement. So we have Q and S as true, whereas P and R as false. We have option C as this combination. QS is true while PR are false. So let's look at the solution further slide. So let's look at the statement P. Statement P said that histamine is beta aminoethyl 5-hydroxyindole derivative, but no, histamine does not have indole in its structure, rather it has imidazole. And statement R said that histamine is orally as well as parenterally active. So even that is an incorrect statement, because histamine is orally inactive and it is administered suitably via the intravenous route. Hence the correct option is option C. The following 5 hydroxytryptamine agonists it is mainly used as an appetite suppressant. The options are buspirone, dexfenfluramine, sumatriptan, or all of the above. Let's look at the solution. So the correct option here is dexfenfluramine, which is used as an appetite suppressant. It is marketed as dexfenfluramine hydrochloride under the name Redux, and it is a serotonergic anorectic drug. It reduces the appetite by increasing the amount of extracellular serotonin in the brain. Remember, dexfenfluramine, so it is the D-enantiomer of fenfluramine, and it is structurally similar to amphetamine, but it lacks any psychologically stimulating effects. So the correct option is B. Next question. Cisapride and renzapride are. So are they 5-HT4 agonist, 4-HT4 antagonist, 5-HT2 agonist, or 5-HT3 antagonist? So let's look at the solution for this. So you all need to know the classification quite well and their functions. Okay. So the question that was asked is cisapride and renzapride. What are they? So they are 5-HT4 agonist, and the 5-HT4 receptor, it couples to the GS protein, which is activate further adenylyl cyclase, and it has been demonstrated in these regions of the gut. Okay, it is also located in the brain. So cisapride and renzapride are the selective 5-HT4 agonists. Please remember the functions of different hydroxytryptamine receptors. Next question. Select the correct option regarding amine, peptide and lipid autocoids respectively. So here you need to know the classification for amine autocoids, peptide autocoids and lipid autocoids. So the combination of statements are 5-hydroxytryptamine, bradykinin and prostaglandin, leukotrienes, serotonin, caladin, serotonin, histamine, angiotensin, or serotonin, somatostatin, or leukotrienes. Let's look at the solution for this. So you need to know the classification as I said. The amine containing autocoids are histamine, 5-hydroxytryptamine, that is serotonin. Then we have the lipid derived autocoids. The examples are prostaglandins, leukotrienes and platelet activating factor. Then we have peptide autocoids, which include plasma kinins, that is bradykinin, caladin and the angiotensin. So the first option, that was 5-hydroxytryptamine, bradykinin and prostaglandin. That is the correct option for this. Hence the solution for this is option A. Next question. Which of the following is the wrong statement for aspirin? So let's look at the options. We have aspirin prevents platelet aggregation. It causes salicylate poisoning. It produces salicylate metabolism, which is inactive, and it is used in the cardiovascular disorder. Let's look at the solution for this. So the correct option here is option C, that is it produces salicylate metabolism, which is inactive. However, it is not inactive, salicylate is active. So let's look a few facts about aspirin. It causes acute salicylate poisoning and it is more common in children. Okay, even in small doses, it irreversibly inhibits thromboxane synthesis by platelets. It interferes with the platelet aggregation. Hence, the correct option A, that is correct. That is aspirin prevents platelet aggregation and bleeding time. then it has no direct effect on heart or blood vessels in the therapeutic dose. However, the larger doses of aspirin increases the cardiac output. Okay, its toxic doses depression vasomotor center, so the blood pressure may fall, and because of the increased cardiac work as well as sodium ions and water retention, congestive heart failure may be seen in the patients with low cardiac reserve. Hence, even option D is correct, that is, aspirin is used in cardiovascular disorder. Next question. Which of the following non opioid agents is an antidepressant with analgesic activity? Okay, they need to be antidepressant as well as giving me analgesic activity. So the options are fluoxetine, moclobamide, tranylcypromine, or amitriptyline. So let's look at the solution. So the correct option here, which gives me antidepressant as well as analgesic activity, is amitriptyline, that is option D, and it is used for a number of medical conditions which also includes major depressive disorder. And amitriptyline is more effective than other antidepressants, which is including selective serotonin reuptake inhibitors, and it is rarely used as a first line antidepressant due to its higher toxicity and overdose and its generally poor tolerability. Amitriptyline is used in addition to other medications for pain as well. Hence, it will give me analgesic activity. Next question. Leflunomide is used in the treatment of which of the following? Rheumatoid arthritis, dermatomyositis, bony metastasis, or postmenopausal osteoporosis. So leflunomide, it is a novel immunomodulating drug. It inhibits the homotypic adhesion of peripheral blood and synovial fluid, and it is used in the treatment of rheumatoid arthritis. Hence the correct option is A, that is rheumatoid arthritis. Next question. Choose the correct statement about paracetamol. So we have the statements as it can't be used in combination with opioid. It is the most common drug implicated to treat moderate pain. In equi-analgesic doses, it is highly toxic than aspirin. And last option is strong inhibitor of prostaglandin synthesis. So let's look at the solution. So the correct option here is option B, that is paracetamol. It is used to treat pain and fever, and it has analgesic as well as antipyretic activity, but a very poor anti-inflammatory action, and it is used to treat mild to moderate pain. Hence the correct option is B. Then we had option A as it can't be used in combination with opioid. That statement is false because it in combination with opioid pain medication, paracetamol is given in severe pains such as the cancer pain and the after surgery pain. So it is given along with opioid. Then paracetamol has negligible anti-inflammatory action. It is a poor inhibitor of prostaglandin. However, in the option D, they said it is a strong inhibitor of prostaglandin synthesis, which is a false statement. Okay, so it is a poor inhibitor of prostaglandin. Remember that. Also, paracetamol has the ability to inhibit COX, that is cyclooxygenase 3 enzyme, and it has analgesic as well as antipyretic action. Next question. Phenylbutazone used as an NSAID is restricted because what of the following reasons? So, phenylbutazone has lower anti-inflammatory efficacy other than NSAIDs. It has potential to cause agranulocytosis. it has weak analgesic action, or it alters the protein binding and metabolism of drug. So let's look at the solution for phenylbutazone. The correct option here is option B, that is, it has potential to cause agranulocytosis. That is the reason it is restricted. So antipyrine, that is phenazone, and aminopyrin, both were introduced as antipyretic, and they showed high incidence of agranulocytosis. That is why they were banned. So phenylbutazone and its active metabolite, that is oxyphenbutazone, both were marketed. They are potent anti-inflammatory drugs. अगर anti-inflammatory है, that means they are inhibiting cyclooxygenase, but have the slow, weak analgesic and antipyretic action. So that is the reason that they are restricted, because of the agranulocytosis. Next question. Select the anti-seizure drug with an analgesic component of effect. So which is the anti-seizure drug giving me analgesic activity? Carbamazepine, ethosuximide, phenytoin, or clonazepam. So the correct option here is option A, that is carbamazepine. So trigeminal and related neuralgias, here in this case carbamazepine is the drug of choice. These neuralgias are characterized by attacks of high intensity electric shock, okay, in the mouth or face. So the drugs benefit by interrupting the temporal summation of impulses, and carbamazepine is not an analgesic but has a specific action in the neuralgias. Hence the correct option here is option A. Next question. The selective COX-2 inhibitors have the following advantages over the non-selective NSAIDs. So let's see the options. They are less likely to cause gastric ulcers and their complications. They are likely to be more effective rheumatoid arthritis. They are not likely to produce renal complications, and all of the above. Let's look at the solution for this. So normally gastric mucosal prostaglandins are produced by COX-1, and selective COX-2 inhibitors are less ulcerogenic. Hence, they are less likely to cause gastric ulcers and their complications. Hence, the correct option is A. Next question. Which NSAID undergoes enterohepatic circulation? Is it aspirin, phenylbutazone, piroxicam, or ibuprofen? So the correct option here is option C, that is piroxicam. We need to know the metabolism of all the NSAIDs. So piroxicam, it is rapidly and completely absorbed. It is 99% plasma protein bound. It is metabolized in liver by hydroxylation and glucuronide conjugation. And here enterohepatic cycling occurs in the case of piroxicam. However, about aspirin, it is rapidly deacetylated in the gut wall, liver, plasma, and other tissues. So aspirin is a prodrug and it gets converted to salicylic acid, which is the major circulating and active form of aspirin. Both are conjugated in liver with glycine to form salicylic acid, which is the major metabolic pathway for aspirin. Next, we have ibuprofen. All the propionic acid derivatives that we have, they will enter the brain, synovial fluid, and they will also cross placenta. They are largely metabolized in liver by hydroxylation and glucuronide conjugation. Okay, so amongst all the given options, only piroxicam is the one which undergo enterohepatic cycling. Next question. The correct statements concerning ketorolac include all of the following except. So we need to know about ketorolac. So does it inhibit COX? It is as effective equally as ibuprofen. It has high potential for physical dependence and abuse, and it does not produce respiratory depression. So let's look at the solution. So the correct option here regarding ketorolac is it has high potential for physical dependence and abuse. So ketorolac inhibits prostaglandin synthesis and relieves the pain primarily by peripheral mechanism. Okay, it is in short lasting pain. It has compared favorably with aspirin. It has several adverse effects, and ketorolac is frequently used in postoperative dental and acute musculoskeletal pain, and it has been rated superior to aspirin, paracetamol and ibuprofen. Thank you so much.